Hey, good afternoon and welcome to EliteHealthOnline.com. My name is Clay, co-owner of EliteHealthOnline.com, and today we have guest Sadia from Texas Star Pharmacy. Welcome, Sadia.
Thank you so much, Clay. Thanks for having me.
Yeah, thanks for being our expert on everything that's in our menu at EliteHealthOnline.com. Sadia, today we're going to be talking about TriMix, and my understanding of TriMix is it's kind of the end of the road. This is the uh, final place to go for folks who just haven't gotten the response from working on to improve blood flow, things like even PT 141 or the tadalafil, sildenafil, troches, those sort of things just are still not working. And now they're on to TriMix. So would you explain to us today what exactly is TriMix? How does it work? Um, why does it work when everything else doesn't? And what
Mhm.
happens if you jump here too soon? I know a lot of patients ask for this. They're just ready to get it solved, but educate us if you would, please.
Yes, absolutely. So, TriMix, as you just mentioned, is just the last option, typically, when all the other physiological and psychological evaluation has been done, and then ruling out that no other therapy is working, then it becomes a light at the end of the tunnel for those patients. So, TriMix is actually a combination of three things. That's why it's called TriMix. And those three things, we can talk about the individual ingredients as well as piperine, phentolamine, and L-prostadil. But what these three typically do, they improve the blood circulation to the area and improve the smooth muscle relaxation. So that helps in achieving and maintaining erection that is required, during uh, uh, the phase. Now, most importantly, when this injection is given, one thing need to be understand and make sure patients very effectively utilizing is the site of injection. It's a penile injection, and when it's prescribed, typically a diagnostic dose is given either in the office or the patient is familiar how to use it, then they can take the prescription, get filled it from the pharmacy and talk to the pharmacist, because this is one product we really focus on every time a patient is getting a prescription for the first time, to see a pharmacist for proper consultation, because the combination of the three ingredients in there is a very temperature sensitive product. So for patients who have to use it frequently, maximum can be used is up to 3 times a week. And there are some occasional users who use less than, once a week, or even less. Then, depending on that, how the injection site should be rotated, what size of needle and dose it should be given, and how it should be stored in order to have the same response every time. We have a number of patients who take the product the first time they use the dose, it gives them a great response and they're happy. And then they're not storing it properly, or either storing it in a refrigerator instead of freezer. And then over time, after 5, 6 uses, they're not getting the same response from the same dose. So we do get patients, hey, it worked in the beginning and now it's not working. So we always want to make sure that they're talking and having proper consultation from the pharmacist about the use, directions for use, what type of precautions they need to look into, and also how to store it. And again, at the end, the dose that works for one patient is definitely not the dose for another patient. So that's one of the trimix related things, when we have patients who come to us and they say, hey, my friend is taking this medication and he uses this much and it works, can I have the same thing? So we always inform them and educate them that it's always going to be very customized formulation based on the dosing guidelines that you're provided. One thing we want to make sure, and we always tell the patients, that do not use it more than 3 times a week. That's the maximum recommended dose. And once it's taken, erection should not last more than 4 hours. So,
Okay.
in case if it's happening, then there is oral OTC, such as Benadryl. 50 milligrams can be taken right away. Typically within 1 hour, it should subside. But if it doesn't, then we have injectable antidote options as well. Let's say if that one is not even working, then the third option is to go see emergency
Right.
doctors. But we, so far in many years of practice, we haven't seen any patient who follows the right protocol had long-lasting, erections and ended up in emergency room. So that's not typically done. But finding the right doctor who knows what they're prescribing
Right.
and exactly giving proper instructions. So patient and doctor both, their knowledge and education is the key for the
Yep.
effective use of this product.
Yep. And we do provide videos online for proper administration. I know you guys counsel all patients as well that we order on. So, um, Sadia, what are we solving here with Trimix? What's the physiology? I know with the Viagra or with the tadalafil and sildenafil, it's blood flow, right? We're creating
Yes.
an aligned blood flow. What are we doing with the Trimix?
It's actually exactly doing the same thing. We have the three ingredients in there. They are designed basically to improve, muscle relaxation at the site. The main difference of this injection versus oral, when oral medications are taken, it's distributed throughout the volume of distribution everywhere in the body. So there is a huge possibility that only 1/10 of the required drug is getting to the site where it's really needed.
So this is
Versus,
concentrated.
yes,
Okay.
exactly.
So
Versus
you
when
still
it's
have to
given,
be aroused. I know a lot of times people think that with Viagra or tadalafil or sildenafil that they're going to get a spontaneous erection. That's not necessary. There still has to be arousal. True with
yeah.
Trimix as well.
Yes, a trimix is a very within 10 minutes. That's the maximum we have seen. It doesn't take usually that long after trimix. Again, if the patients have been evaluated for any psychological conditions, because we have patients who do say even trimix was not, working in specific situations, such as the patient was under a lot of stress, and then or it was some sort of anxiety related, spell was there on the patient at that moment. But otherwise, if other psychological, reasons have been ruled out and patient does not have any other condition, and the neurotransmitter wise, the brain chemicals are normal within normal range as well, then trimix typically does not take more than 10 to 15 minutes. It's very rare that we see patients who say that it's not working even past 10 minutes.
Okay. And the injections, a little bit about, I know they're very small needles, very
Yes,
tiny.
they're
It's almost
insulin
like a
needles.
insulin
Yes,
top syringes. Painful, like for the person who's never done this before, educate us on what they can
yes, there
experience.
will
Pretty.
be. Yes, penile pain is something that is, given as a proper, indication that you will experience pain at the site of injection, because it's very heavily innervated, because there's a lot of nerves and
Mhm.
in the area, and of course when it's injected, nerve can transmit the pain signals pretty fast. So pain, scarring and bruising happens over time if someone is using it more frequently and for long term. But otherwise, it's not something that is very common. That's why rotating sides, such as left or right, is very highly advised. And using the right side needle, typically insulin size needle, and the dose is about 10 units to 20 units, zero point 0.1 to zero point 0.2 ml. It's something that works majority of the time. However, some patients use zero point 0.1 to 2, zero point 0.1 to zero point 0.2 ml. It works great for the first year, and then later on they say, "Hey, the zero point 0.2 doesn't work anymore. Can I increase it?" And that's where, zero point 0.2, let's say if they are increasing it to zero point 0.3 or zero point 0.4 ml, that's doubling almost, or increasing it by, 150%. Then in that case, there is more pain and more bruising is expected. Very rarely that the patients would complain about headaches and dizziness, but if it happens, it's always when the dosages are changed or adjusted,
Okay.
and
Excellent.
it should go away, yeah, after the doses are
Excellent.
adjusted. Yeah.
Excellent. Well, it sounds like we have solutions, and I'm excited that we do have these solutions. There's a handful of patients that do use this regularly. It's their last alternative. So if you're one of those folks that the sildenafil, tadalafil, or the PT-141 is not cutting it, maybe TriMix is something to consider. Our providers will be happy to speak with you about that, You have a good partner here with Techstar Pharmacy to help you with administration and understanding how to properly take that. So you'll have that resource at your disposal as well. And you guys are calling every patient, offering uh,
Yes.
the counseling, as well as we do send the anecdote um, with the very first shipment. So, Saudi, again, thank you for being with us. Folks, if you're out there and you need this, visit us at elitehealthonline.com. You can get on with one of our providers. They'll do an evaluation, and we can get this sent out within 24 to 48 hours if it's a good fit and you qualify. Don't hesitate to visit us. Thank you.
Thank you. Have a good day.
All right. Thank you, Saudi. Bye bye.